Good day, dear students. I am Chimidronov Sergei Nikolaevich, the head of Human Anatomy Department in Samara State Medical University. Today we will talk about urinary system. Urinary system, you know that this is a part of urogenital apparatus. And first I want to tell you about excretion, the function of excretion. And 4 our systems take part in this process. The main system is urinary system, and today we talk about this system in details. But also I want to tell about digestive system, such as excretion functional system, also a respiratory system. We can excrete the metabolism through expiration through expiratory air, and also our skin is also takes part in excretion. Also sweat and sebaceous glands in skin, and you may see these organs of this system on the pictures. You may see the kidney is a main organ in urinary system. Also you may see the saliva in digestive system, such other glands in digestive system who can excrete the metabolism through the mucous layer in digestive system. Also, you know, a respiratory system, lungs. Through lungs, you know that lungs also takes part in excretion. Some metabolism eliminates through respiratory system during our expiration. And also skin, sebaceous and sweat glands, and some metabolisms go out from our body via these glands, sweat and sebaceous glands. But the main system who excretes the metabolism substances is urinary system. And urinary system divides in 2 parts. Urinary organ who produce the urine, this is kidney, this is pair organ, and also urinary tract. Some organs of urinary tract, through these organs, the urine go out from our body. First, there are 2 ureters. Ureter also pair organ, and each ureter go to bladder. This organ is impaired to store the urine, and also urine go out through urethra. This is little channel to environment, external environment. So kidney. Kidney is paired excretory organ producing the urine. Kidneys are situated on the posterior abdominal wall behind the peritoneum. You may see the peritoneum in green color, and also you may see in violet color pair kidneys. So kidneys are situated on the posterior abdominal wall behind the peritoneum on either side of the vertebral column on the level of the last thoracic and upper 2 lumbar vertebrae. The right kidney is a little lower than the left, by 1–1.5 centimeters on average, depending on the pressure exerted by the right lobe of the liver. You may see right kidney and liver here. So the upper end of the kidney reaches to the level of the 11th rib. The lower end is 3, maybe 5 centimeters from iliac crest. The kidney is bean-shaped organ. Its surface is smooth and dark red. The kidney are distinguished. The upper and lower inferior ends or paws or extremities, lateral and medial margins, and the anterior and posterior surfaces. The lateral margin is convex, you may see it here, while the medial margin has concavity in the middle and faces not only medially but slightly downward and to the front. The middle concave part of the medial margin contains the hilum of kidney. You may see the kidney hilum, through which arteries and nerves enter the kidney and veins, and the ureter leave it. You may see ureter here. The hilum opens into a narrow hollow extending into the renal substances. It's called the sinus of kidney, sinus renalis. The relations of the anterior surfaces of the right and left kidneys to the organs are different. The right kidney is projected on the anterior abdominal wall, you may see it also here, in the epigastric, umbilical and right lateral abdominal regions. The left kidney is projected in the epigastric and left lateral abdominal regions. A small area of the anterior surface and the right kidney is related to the suprarenal gland. You may see these glands here, suprarenal glands. So further downward, a greater part of this surface joins the liver, while its lower third comes in contact with the right flexure of the column. So you may see right flexure of column here, and also you may see inferior posterior surface of liver on the right picture. The descending part of duodenum passes on the medial border. You may see this topographic picture of duodenum on the medial border of the kidney. The latter two areas are not covered by peritoneum. The distal end of the right kidney has a serous covering. Near to the upper end, part of the anterior surface of the left kidney, like that of the right kidney, is covered by suprarenal gland. You may see number 1. Immediately below this area, the upper third of the surface is related to the stomach. We can see the part of stomach here. The middle third of the pancreas, you may see the part of pancreas here, and the upper part of the lateral border of the anterior surface to the spleen. You may see particularly spleen and spleen arteries and vein. The lower end of the anterior surface is related to jejunum loops. You may see particularly the initial part of jejunum. The upper part of the posterior surface of both kidneys lies on the diaphragm. You may see diaphragm on this right picture, which separates the kidney from the pleura. Below the 12th rib, the posterior surface is related to the psoas major and quadratus lumborum muscles. You may see particularly these muscles here and here. This is part of iliopsoas muscle, musculus iliacus. So, the capsules of kidney. The kidney is invested in its own fibrous capsule, capsule fibrosa, a fine smooth lamina intimately attached to the renal substance. Normally, it can be separated from the renal substance quite easily. You may see this capsule here in black color. So, the fibrous capsule consists of 3 layers: an outer fibrous layer, middle muscular layer, and third inner supraparenchymatous layer. Due to such structure, the fibrous capsule accomplishes its functions: mechanical, fixation of kidney and protection of its parenchyma, and contractile, facilitating filtration. Outside this fibrous capsule, particularly in the region of the hilum and on the posterior surface, is a layer of loose fatty tissue forming the fatty capsule. You may see this fatty capsule on this picture, or renal fat, or capsule adiposa in Latin. The anterior surface is quite often not covered by fat. You may see the anterior surface and absence of the fatty tissue or little presence here. Outside each kidney is invested in a connective tissue fascia, which is connected with the fibrous capsule by means of fibers and separates in two layers, one covering the anterior and the other is the posterior surface. On the lateral border of the kidney, both layers unite and are continuous with a layer of retroperitoneal connective tissue which had given origin to them. You may see these fascias here. On the medial margin of the kidney, the layers do not unite but pass separately to the midline. The anterior layer passes in front of the renal vessels, aorta and vena cava inferior, to unite with its fellow layer on the contralateral opposite side. The posterior layer passes in front of the vertebral bodies and is attached to them. At the upper extremity of kidney, both layers also invest the suprarenal gland. You may see this gland here and investigation the fascia, this gland here. So such union of the layers is usually not noticeable on the lower extremity. You may see the absence of unite these layers. It passes downward. A complex of the following structures is responsible for fixation of the kidney in place. Fascia renalis first, which fuses with the renal capsules. The muscular seat of the kidneys formed the psoas major and quadratus lumborum muscles. We talked about these muscles in musculatory or muscle system. Muscle system, the muscles of lower extremity and also the muscles of body. Next, renal vessels, which prevent the kidney from moving away from aorta and vena cava inferior. And so finally, intra-abdominal pressure produced by contraction of the muscles of abdominal wall. If the fixation apparatus is weak, the kidney may distend, mobile or wandering kidney, which calls for its operative fixation with sutures. You may see the pathway of this migration downward. Normally, the long axis of both kidneys being directed upward and medially meet, being held in place of the midline by the vessels, are displaced downward and medially, like on the periphery of circle. As a result, the long axis of the kidneys intersect below them, forming the angle open upward. And so you may see this fixation apparatus here, and we can repeat fibrous capsule, peripheric fat or paranephros, renal fascia, and also abdominal pressure. Abdominal pressure. Next, let's repeat vascular pedicle, renal artery and vein, muscles attached to the kidney, intra-abdominal pressure, as I told you, and also fat capsule, fascias and peritoneum. You may see the kidneys on this X-ray investigation here in actual section. So next, let's we talk about structures of kidney. So on the longitudinal section through the kidney, it can be seen that on this picture that it's composed of a cavity or renal sinus here, contained the calyces and the upper part of renal pelvis, and of the renal substance proper adjoining the sinus. Next, we can see cortex and medulla. So the cortex occupies the peripheral layer of the organ, and it's about 4 mm thick. The medulla is formed of conical structures called renal pyramids. You may see renal pyramids here, or pyramids of Malpighi. The wide bases of these pyramids face the surface of the organ. You may see the basic part of pyramids, and also you can see the apices. They directed towards the sinus. 2 or more apices join to form rounded eminences termed the renal papilla, papilla renalis. Less frequently, a single apex constitutes one separate papilla. There are a total of about 12 papilla on the average. Each papilla is dotted with small openings, papillary foramina papillaria, through which the urine is discharged into the initial part of the urinary tract, calyces. You may see calyces minoris here. The cortex penetrates between the pyramids and separates one from another. These parts of the cortex are known as renal columns, columna renalis, and you may see these columns here between pyramids. The pyramids appear striated because the urinary tubules and the vessels are arranged in them in a straight direction. The presence of the pyramids reflects the lobular structure of kidney. You may see column, you may see pyramids, and you may see area cribrosa, a little tiny holes in the apical part of pyramid. Also, you may see the part of cortex renalis and medulla renalis. So, you may read the term segment of kidney. Segment is section of the parenchyma with a separate blood supply from the segmental artery. And you may see the segmental artery here. This is branch of renal artery. The human kidney belongs to the group of smooth multipapillary kidneys. Evidence of this is a presence of grooves in the outer surface of the kidney of newborn, a sign of the original separation, groove kidney, of fetus and newborn. In adult, the kidney is smooth on the outside, but inside it remains separated into lobules, pyramids, through several pyramids fused to form a single papilla. You may see papilla, which explains why the number of papilla is less than the number of pyramids. So you can see area cribrosa, the distal part of apical part of one of some pyramids here. The stria of the medulla continue also in the cortex, you may see it here, but are less distinct here. They form the radiate part, pars radiata, and you may see a part of part radiata here. A radiate part of the cortex, whereas the part between them is the convoluted part. You may see this part between neighbor radiates. Pars convoluti in Latin. The radiate and convoluted parts are united under the term cortical lobulus. You may see the cortical lobulus here. The kidney is a complex excretory organ. It contains tubules called urinary or renal tubules, tubuli urinalis. The blind ends of these tubules surround as double-walled capsules, and you may see tubules here and capsula here. So these capsules tuft over capillary blood vessels. Each tuft or glomerulus lies in a deep bow like hollow in the capsule, known the glomerular capsule, capsule glomeruli, or Shumlansky-Bowman capsule. The space between the two layers of the capsule is its cavity and the beginning of the renal tubule. You may see the cavity between two of these layers in capsule. So you can see the nephron, structural and functional unit of kidney, and this nephron divides in two parts. First part is capsule with the glomerulus, and next part include tubules of nephrons. So glomerulus together with the capsule enclosing it forms the renal corpuscle. Corpusculum urinalis, or the Malpighian-Shumlansky corpuscle. The renal corpuscles are the convolute part of the cortex and can be seen in it with the naked eye as red dots. The renal corpuscle give rise to the convoluted tubule, tubuli urinalis contortus, you may see these tubules here, which passes in the radiate part of the cortex. The tubule then descends into the pyramid, bends upon itself to form Henle loop, and you may see Henle loop here. This is a part also of nephron. Ansa nephri, it's in Latin, or Henle or nephron's loop. So you may see that this part returns to cortex. The terminal segment of the renal tubule, the junctional segment, drains into the collecting tubule. You may see this collecting tubule or collecting duct here. Tubuli colligens, it's in Latin, which receives several tubules. You may see these several tubules here, and passes in the straight direction through the radiate part of the cortex and the pyramid. The straight tubules gradually fuse with one another to form 15 or 20 short papillary ductals, ductus papillaris. You may see these ductals here on this picture, opening by means of the papillary foramina, lithoforamina, in the cribriform area on the apex of papilla. So, as I told you, the structural unit, and I repeat you, is nephron. According to the findings of microscopic anatomy, I repeat, it consists of following parts. The corpuscle of kidney, you may see here, corpusculum urinalis. The renal corpuscle give rise to proximal segment consisting of proximal convoluted tubule which is continuous to the proximal straight tubule. Proximal straight segment is continuous with a thin loop, Hanle loop, which has two limbs, descending and ascending. The ascending lip of Hanle's loop is continuous with a distal segment consisting of the thick ascending limb. You may see it here on this picture. In turn continuous with the distal convoluted tubule. Also you can see this tubule here. And then with the junctional tubule or collecting duct. The junctional tubule drains into the collecting tubule. The structural components of the nephron are arranged in the kidney parenchyma in the following order: the renal corpuscle, the convoluted and straight tubules of the proximal segment, the thick ascending lip of nephron loop, and the distal convoluted and junctional tubules are situated in the cortex. You may see the cortex, I repeat, here. The thin ascending and descending lips of Hanle's loop, the thick ascending lip of a nephron, and the collecting tubule are situated in medulla. And you may see these structures here in medulla. The nephron is concerned with the production of urine. Outer filtration takes place in the glomeruli, reabsorption and secretion in tubules. So you may see the corpuscle, you may see the capsule and glomerulus. Also you may see the main processes in nephron: outer filtration, selective reabsorption and secretion. Each kidney contains up to 1 million nephrons, the totality of which constitutes the main bulk of the renal substance. To understand the structure of kidney and its structural unit, the nephron, one must know its vascular system. So, renal artery arises from aorta. You may see renal artery, and you may see kidney. Renal artery goes to renal hilum, separates into arteries according to the parts of the kidney, namely vessels for the upper pole, the superior polar arteries for the lower pole, inferior polar arteries, and for the middle part of the kidney, the central arteries. At the kidney parenchyma, these arteries pass between the pyramids, between the lobes of kidney. You may see that artery passes between pyramids, and therefore called interlobar artery. Interlobar artery. At the base of the pyramid and junction of the medulla and cortex, they form arterial arches. You may see arterial arch and arch-form arteries. Arch-form arteries or arteria arcuata, it's in Latin, which give rise to the interlobular arteries. You may see interlobular arteries here, the branches of arteries. So each interlobular artery gives origin to vas afferens. You may see vas afferens, which ramifies to form a tuft of convoluted capillaries or glomerulus imaginated to the initial part of the renal tubule, capsula nephri. The vas efferens emerging from glomerulus again breaks up into capillaries, which first surround the renal tubules, and only after that they are continuous with the veins. The veins accompany the corresponding arteries and leave the renal hilum as a common trunk. You may see it here, and goes to vena cava inferior. Venous blood drains from the cardiac first into the stellate veins, venule stellata. You may see here. Then into interlobular vein, accompanying the interlobular arteries here. And then into arcuate vein. Venous blood from the medulla flows in the venula recta. The large venous tributaries unite to form the renal vein. In the region of the renal sinus, the veins are in front of the arteries. The kidney therefore contains two capillary systems. You may see two of these systems here. One connects the arteries with the veins, while the other is of special character, comprising a vascular tuft, in which blood is isolated from the capsular cavity by only two layers of squamous cells, endothelium of the capillaries and endothelium of capsule. So, I repeat, two capillary systems. One system is common system, such in other organs, and second system in capsule. You may see that arteriola passes into capillaries, and then arteriole deferens or vas deferens exit from capillaris glomerulus, not venula, arteriole, because there is no gas exchange on this capillary structure. The gas exchange is situated here on this second capillary network. So you may see the nephron here, and I repeat three processes which go in nephron. And so you may see ultrafiltration and form primary urine. Primary urine goes through canal system of nephron, and the process in this canal system is named selective reabsorption. You may see the reabsorb of substances in blood system here. And next process is excretion. It goes in distal part of nephron tubules here, distal recti and convoluted or convected tubules. So you may see on this picture the lobes of kidney. Also you may see renal artery, vein, and also you can see on this picture nephron, the capillary glomeruli here and here, and also tubular system of nephri. Let's tell some words about function of kidneys. The main function is secretion, and also water and salt balance with urine output. Salt has the same term, electrolytes. Next, endocrine function, because kidney produce the hormone renin, it's called renin, and the renin takes part in blood pressure regulation. Also metabolic function, because kidneys and also urinary tract evacuate the metabolism from body to environment, and also kidney takes part in hematopoiesis. to produce hematopoietin, uh, which take part in hematopoiesis in rubber metal. So let's talk about urinary tract. So urine flowing from the papillary foramina, as I told you, passes on the way to the urinary bladder through the lesser calyces, greater calyces, and renal pelvis and ureter. Lesser calyces, you may see them here, or minor calyces, calyces renalis minoris, about 8 or 9 in number, and close 1, 2, rarely 3 renal papilla, with the end of the drain into one of the major calyces with the other. There are usually 2 greater calyces. You may see major or greater calyces, calyx. Superior calyx and inferior calyx. They merge in the renal sinus to form a single renal pelvis. You may see renal pelvis, which leaves the kidney through the hilum behind the renal vessels and carrying downward is continuous with the ureter directly below the renal hilus. Let's talk about fornical apparatus. Each renal calyx surrounds the conical renal papilla like a double-walled goblet. As a result, the proximal part of the calyx around the base of the papilla is elevated above the axis of papilla as a vault of fornix. The wall, you may see fornix here. The wall fornix contains smooth muscle fibers, musculus sphincter fornices, which together with the connective tissue embedded here and the adjoining nerves and blood and lymphatic vessels constitute the fornical apparatus of the kidney. It plays an important role in excretion of urine from the renal parenchyma into the renal calyces and prevents the return of urine from the calyces into the renal tubules. Since vessels are in close relation with the wall of the fornix, hemorrhages occur here more easily than in other places, and urine passes into the blood purely venosus or reflux. It's pathologic, which is conducive to the penetration of infection. 4 muscles are distinguished in the wall of renal calyx, which are situated above the fornix. Musculus levator fornices around it, musculus sphincter fornices, along the calyx musculus longitudinalis calyces, and around the calyx musculus spiralis calyces. The levator fornices and longitudinal calyces muscle dilate the cavity of the calyx and facilitate urine accumulation diastole, while the sphincter of the calyx facilitate urine accumulation, while the sphincter fornices and spiral calyces muscle cause constriction of the calyx and evacuation systole. The activity of the calyx is connected with a similar activity of the renal pelvis. So you may see lesser calyces, greater or major calyces, and part of pelvis renalis. So the calyces, renal pelvis, ureters constitute the macroscopically visible part of the excretory tract of the kidney. 3 types of excretory tree can be distinguished: embryonal type, fetal type, and mature type. Embryonal type marked by a white sac-like pelvis into which the lesser calyces drain directly. The greater calyces are absent. Fetal type with many lesser and greater calyces which are continuous with the ureter, the renal pelvis is absent. And mature type with the few lesser calyces which merge to form 2 greater calyces continuous with the moderately developed pelvis that drains into the ureter. So all three components of the excretory tree are present here: lesser, greater calyces, and renal pelvis and ureter. You may see these parts here: lesser calyces, greater calyces or major calyces, and pelvis, which passes into ureter. So, ureter is a tube about 30 centimeters, you may see it here, with diameter 4-7 millimeters. From the pelvis renalis, ureter passes behind the peritoneum, downward and medially in true pelvis, where it extends to the floor of the urinary bladder. You may see urinary bladder here, whose wall is pierced obliquely. In the ureter are distinguished an abdominal part, you may see abdominal part, from its origin to the place where it curves over the linea terminalis to enter the true pelvis here. The ureteral lumen is not uniform in height and has constrictions. First constrictor near this site where the renal pelvis is continuous with the ureter. Next second at the junction of the abdominal and pelvis part here. And third constriction along the distance of the pelvic part in urinary bladder. So the female ureter is shorter and the relation of inferior part of ureter in female to the organs differs from those in the male ureter. In the female pelvis, the ureter extends along the free border of the ovary, then the base of the broad ligament of the uterus. It lies lateral to the cervix uteri, penetrates into the space between the vagina and the bladder, and pierces the wall of the bladder in oblique direction like the male ureter. The walls of the ureter, like the walls of the renal pelvis and the calyces, consist of three coats: an outer connective tissue and tissues coat, an inner mucous coat covered with transitional epithelium supplied with a small mucous gland, and middle muscular coat, tunicum muscularis. The muscular coat is formed of two layers, an inner longitudinal and outer circular layers. These layers are not connected with the musculature of the bladder and prevent urine from flowing from the bladder back into the ureter. At the site where the ureter drains into the bladder is the third outermost longitudinal muscular layer, which is intimately connected with the muscles of the bladder and contribute to expulsion of urine into the bladder. The ureter of a living subject you may see here in this X-ray tomography. Next, let's talk about urinary bladder. So, urinary bladder is a receptacle for urine which is excreted at regular intervals through the urethra. You may see the initial part of male ureter here. Its capacity is over 50 milliliters, but may vary considerably in individual cases. The shape of bladder and its relations to the adjoining organs greatly change depending on the extent of its filling An empty bladder lies completely in the cavity of true pelvis behind the pubic symphysis. Posteriorly, it's separated from the rectum by the seminal vesicles and the terminal parts of ductus deferens in males and by the vagina and uterus in females. When the bladder is filled with urine, its upper part changes in shape and size and rises above the pubis and, if greatly distended, reach to the level of the umbilicus. A filled bladder is egg-shaped, and the lower, wider and attached part, the base, fundus, is directed to the rectum or vagina, gradually narrowing. It continues with the urethra by means of neck, cervix ureter, cervix vesica. This sharpened apex, you may see it here, of the bladder, apex vesica, is related to the inferior part of the anterior abdominal wall. The middle part between the apex and the base now is known like body of bladder, corpus vesicae. A fibrous cord, the median umbilical ligament, stretch from the apex to navel or umbilicus of the posterior surface of the anterior abdominal wall to its midline. The bladder has an anterior, posterior and lateral surfaces. The anterior surface lies on the pubic symphysis, from which it is separated by loose areolar tissue filling the prevesical or retropubic space, spatium prevesicale or retropubicum. The upper part of the bladder is more mobile than the lower part because the latter is attached by ligaments formed and expands of the pelvic fascia, and in males is also fused with the prostate gland. You may see the prostate gland in male here. The superior surface of the bladder is related to the intestinal loops in males and to the anterior surface of the uterus in females. When the bladder is distended by urine, its upper part rises and becomes rounded and protruding above the pubis pulls upward the peritoneum reflected onto it from the anterior abdominal wall. The walls of distended urinary bladder can therefore be punctured through the anterior abdominal canals without involving the peritoneum. Posteriorly, the peritoneum is reflected from the superior posterior surface of the bladder onto the anterior surface of the rectum pouch. So this picture is in males. And also in females, anterior surface of uterus, uterovesical pouch. Besides the seroscalled tunica serosa covering the posterior wall on the apex of a bladder, the constituents of its wall are the muscular coat. You may see the muscular coat here. Tunica muscularis formed of smooth muscle fibers. The submucous coat, thallus submucosa, and mucous coat, tunica mucosa. Three intertwining strata are distinguished in the muscular coat. External, stratum externum composed of the longitudinal fibers. Middle, stratum medium of circular or transverse fibers. Internal, formed the longitudinal and transverse fibers. These three layers of smooth muscle fibers form the common muscle of the urinary bladder, which on contraction reduced the cavity of bladder and expel the urine from it. Pubovesical muscle or musculus detrusor urinae. The middle layer is developed most especially in the region internal orifice of the urethra, where it forms the sphincter vesica muscles. Around each urethral orifice is also a sphincter-like structure of strong circular fibers of the internal muscular stratum. You may see the opening of ureters here, and they around it the sphincter muscles cells. The inner surface of the bladder is lined with a mucous coat which forms folds. You may see folds, little folds in bladder, which forms folds, as I told you, in empty bladder due to the presence of a rather well developed submucosous coat. These folds disappear when the bladder is distended. An opening is visible on the inner surface of the inferior part of the bladder. This is internal orifice of the urethra. Directly behind it is smooth triangular area called trigon of bladder. You may see this trigon of bladder. Its mucous coat adheres to the muscular coat and never forms folds. You may see the absence of folds here. The apex of trigon faces the internal urethral orifice. You may see internal urethral orifice. At the corners of the base of the trigon are the orifice of ureters. The base is bounded by the passing between the orifices of the ureters. Behind this fold there is a depression in the cavity of the bladder called the fossa retroureterica. Fossa retroureterica, which increases in the side with the growth of the prostata. Sometimes there is an elevation directly behind the internal urethral orifice. This is the uvula of bladder, uvula vesica. It's mostly found in the elderly due to the strongly developed middle prostatic lobe. Mucous coat of the bladder is reddish in color and is lined with transitional epithelium similar to the ureteral epithelium. Small mucous vesicle glands and lymph follicles are embedded in the mucosa. So you may see the cavity of bladder, and also you may see the male urethra. In male urethra, you may see three parts. Prostate part, inside the prostate gland. Next part is situated in the perineal membrane. This is membranous part. And third part in the sponginous body of penis. You may see third part here. This is male urethra, which is not only urinary tract, it also a part of reproductive system. But female urethra is only urinary tract without reproductive system. Let's tell you about female urethra some words. Female urethra arises from urinary bladder. Its tube about 3-4 centimeters in length, convex slightly to the back and carrying behind and below the inferior border of symphysis pubica. Except during the passage of urine, its anterior and posterior walls are in contact, but they are distinguished by considerable elasticity, and the ureteral lumen may be distended to a diameter of 7-8 millimeters. The posterior ureteral wall is intimately fused with the anterior wall of vagina. The external urethral orifice opens in front of and above the opening of vagina and is narrow part of the urethra. The wall of female urethra consists of muscular submucous and mucous coats. In the loose submucous coat is a vascular network which also penetrates into muscular coat. It lends the tissue the carinous appearance on section. The mucous coat is arranged in longitudinal folds. So numerous small mucous glands open into the urethra, like in female and also in male urethra. You may see these little tiny small openings of urethral glands in male urethra. Litre glands. So you may see some features in newborn. You may see the kidney of newborn. So you may see that in compare suprarenal glands has the same parameters like newborn kidneys here. So I told you that there are a lot of grooves and lobes renalis with cortex, and so medulla renalis is not so presented like in adult kidney. So you may see that the surface of this kidney is not smooth, and it has grooves, and these grooves are situated up to 2 years old, child 2 years old. And next I want to tell about some abnormalities of kidneys and urogenital tract. Ren lebatus lobaris. So if adult person has these lobaris or grooves kidney, this is abnormal for adult person. This is normally for little child up to 2 years old, but there is abnormal in adult person. Next, this is one or both kidneys located in pelvis, pelvical transposition. Third kidney, and it smaller than normal, and this is dislocated kidney. Absence one of kidneys, agenesia, it calls agenesia renis. Fusion of kidneys, horseshoe-shaped kidney or ren arcuatus. Next, fusion of kidneys with two poles, superior and inferior poles. This is annular kidney, double kidney, double ureter, polycystic kidney. So you can see third kidney here, 1, 2, 3. This is smaller than two others. Polykystose, polycystic kidney. Annular, horseshoe kidney, horseshoe-shaped kidney. You may see the fusion with the inferior poles. And also you may see transposition kidney, also pelvic kidney, normal kidney, nephroptosis, and upper kidney. All these abnormalities are a transposition of kidney from normal localization, such this one. Also, you may see transposition to opposite side, one of kidneys, and also you may see 4 kidneys here on this X-ray examination, 2 normal kidneys and 2 hypoplastic kidneys with ureters. You may see 4 ureters, 2 in one side and 2 in other side. Also, you may see 4 kidneys here with 4 ureters on this X-ray examination with contrast. Next, you may see abnormalities: rectobladder fistula, demands immediate surgical intervention; rectovestibular fistula. This is connection between rectum and bladder, between rectum and vestibulum of vagina. Next abnormality is urachus. The lumen in urachus, fistula or connection between bladder and navel, umbilicus. In normal body, the lumen in urachus is absent, and so urachus in adult person is connective tissue ligament, which covered with peritoneum and form mediana umbilical throat. So you may see these abnormalities on this picture. You may see the connection of bladder with the navel. You may see the duct, it calls urachus, and little particular obliteration of urachus here, proximal, also distal obliteration, and proximal and distal obliteration here. So you may see the umbilicalis cyst is also abnormal for a person. And here you may see the diverticulum of bladder and particularly obliteration of urachus. Next, you may see the connection between rectum and vagina, rectovaginal fistula. Also, you may see it here. And also, you may see the absence of lumen in distal part of rectum, and rectum opens into bladder or into urethra. Like this, you may see the opening of rectum in bladder. It's abnormal because it must be open in each opening on the perineum. So you may see the opening of rectum in urethra in male. Also atresia of rectum and absence of connection between these parts of rectum. And also you may see the opening of rectum in vagina, in female. Also you may see the opening of rectum in scrotum, and opening and connection with vagina, and opening in own place. You may see the fistula of this picture, the connection between the rectum and vagina in little child. And so you may see the heart abnormality of bladder. This is the abnormal absence of anterior wall of bladder. You may see only posterior wall. So this abnormally is very hard. You also may see umbilicus, and this abnormality causes extrophy of bladder. Extrophy of bladder. I repeat that this abnormality is the absence of anterior wall of bladder, and must be surgically corrected. So our lecture is finished. Thank you very much for your attention. See you again next time. Goodbye.